Hi there, Corazon volunteer. This is Katherine Eichmann, the co-chair of Corazon Clinic here, and in this video, I'll discuss the basics of charting the physical exam. I'll go through each body system and explain what the system covers, what exam is performed, what the indication is, and what you should document. This is not an in-depth video about performing and charting the physical exam, but it will give you a good head start. So here again, we're looking at the objective section of our SOAP note. You'll see the body system listed here: general appearance, neuro, GI, musculoskeletal, and gait posture transfer, which again is a part of the musculoskeletal system, HEENT, head, eyes, ears, nose, throat, respiratory, cardiovascular system, and the skin exam. Again, as a reminder, our chart is missing the psych system, but we document the psych symptoms in the neuro section along with the separate psych evaluation form. In the following slides, I'll go through these systems one by one, and I'll explain what exam is performed for each system and what a typical response is, or what you should chart. You'll be surprised that some of these systems don't require much effort and are super easy to chart. Again, this won't be a really exhaustive list of every single response or charting example, and I won't explain how to perform the exams, but at least you'll have an idea of what to do and how to document it. And of course, if you ever need help with performing a physical exam or documenting what you see, please go ahead and ask one of our trainers, providers, or one of our board members. First, we have general appearance. This section is for documenting how the patient appears in office. Are they in distress? No distress? Are they anxious, angry, tearful, agitated, comatose, manic? However they present in the office, document it here. This only requires your direct observation, so it should be done at every single visit, no excuses. This physical exam is very easy to perform and document. The most typical response you'll see is no apparent distress, or NAD, which means that the patient presents calmly without any distress. In charting, we use acronyms, and you'll see a few of them here while we're charting. NAD is one of them. So while you're getting started, it may be best for you just to write them out. Now, with that being said, if a patient is in distress, do not put NAD because that would be false. Instead, document how they are presenting. If agitated, state patient appears agitated in office. If tearful, state patient appears tearful in office. State how they are presenting. Next, we have the neurological section. Again, note that Corazon Clinic documents psych here, but normally psych has its own section. The neuro section includes the cranial nerve exam, sensation, muscle strength, and reflexes. Indications include numbness and tingling, headaches, weakness, musculoskeletal complaints, seizures, loss of vision, and diabetes. Here are just a few examples of typical responses, such as the cranial nerves grossly intact. This should be used when just by observation you can tell that the patient's cranial nerves are intact just because they're looking at you, responding to you, and talking. If you perform a full cranial nerve exam, then you can be specific about which ones are intact. Otherwise, you can just put grossly intact. There is also PERLA, which stands for Pupils Equal, Round, and Reactive to Light and Accommodation. This exam documents how the pupils react when they're exposed to light. This is also can be documented in the eye section, or the HEENT exam as well, but I included it in the neuro exam for this presentation. Most commonly, you're going to see something that says A and O times some kind of number, either 1 through 4. This is a psych component, and again, we include psych in our neuro exam at Corazon. The numbers 1 through 4 refer to person, place, time, and situation, and the number stands for how many of these elements the patient is alert and aware of. For example, you can gather this by asking the following questions. What is your name? It's for person. For place, where are you? For time, what's the time and day? And for the situation, what happened to you? Sometimes you don't need to ask these, you can just gather them from your interview. However, for those who aren't alert or if they're dissociated, it's important to ask these questions. If they're not alert and oriented to one or more of those components, state A and O are alert and oriented, and the number that they are alert and oriented to, and then which elements that they're not oriented to. So if they're ×1, they're oriented to person. If they're ×2, they're oriented to person and place. If they're ×3, they're oriented to person, place, and time. And if they're oriented to 4, they're oriented to person, place, time, and situation. So for example, I have down here A and O ×2, not oriented to time and situation. So that's how you would document that. Next on the list is the gastrointestinal or GI exam. This physical exam includes inspection of the abdomen, auscultation of bowel sounds, palpation of the abdomen, and percussion. Indications for the abdominal exam include abdominal pain, pelvic pain, constipation, diarrhea, nausea and vomiting, UTI symptoms, or low back pain. Not all exam rooms have an exam table, so if you need to perform an abdominal exam and you don't have a table in your room, please let one of the board members know and they'll switch around their rooms for you. Typical responses include the abdomen is soft and non-tender, no palpable masses, or hepatosplenomegaly. That is a typical normal exam. No CVA tenderness, which is referring to the costovertebral angle tenderness, which looks for a kidney pathology. Normal bowel sounds heard in all 4 quadrants versus active bowel sounds versus no bowel sounds heard. Right lower quadrant or RLQ TTP, tenderness to palpation. Right lower quadrant is tender to palpation. Or rebound tenderness in the left lower quadrant or LLQ. Those are just a couple examples for you just so you can get an idea of what this looks like. Next, we have the musculoskeletal exam or the MSK exam. The musculoskeletal exams involves inspection, palpation, range of motion, and special orthopedic maneuvers. Indications for the musculoskeletal exam are pain, which we see a lot of at Corazon, limited range of motion, recent trauma, and arthritis, which is basically also pain. If a patient complains of pain in one of their joints, I strongly encourage you to evaluate that joint. Ask a provider for assistance if you need it. I believe that the MSK exam is one of the most overlooked exams. If a patient is complaining of joint pain, there should be no reason why an exam shouldn't be performed. Palpation just requires touch, so even if you don't know what you're looking for, at least touch the patient in that joint to figure out where their pain is. Okay, my rant is over, but let's talk about gait and station. Gait and station falls under the MSK category as well, and you'll see this on the chart. Gait refers to how the patient is walking, and station refers to standing. A normal gait is effortless with the arms moving normally, swinging at the sides. So you want to look for this as well as a disturbance of posture, balance, loss of arm movement, or any abnormal leg movements. A gait that is unstable is termed ataxic. And an antalgic gait is a gait that develops as a way to avoid pain while walking. Antalgic literally means against pain. So with an antalgic gait, the stance phase of the gait is abnormally shortened relative to the swing phase. It's a good indication of what weight-bearing pain typically. Often those who have antalgic gait or ataxic gait will present with a cane or a walker or sometimes even a wheelchair. If the patient walks with the assistance of a device, always indicate this in the chart. So charting examples of gait and station are patient exhibits an antalgic gait, walks with the assistance of a walker, or if the gait and station is normal, all you have to say is gait and station intact or gait and station normal. Again, this is very easy and requires just direct observation, so it should be done at every single visit. There's no reason why it should be missed or be missing. Other examples include right knee with moderate effusion or swelling and tenderness over the medial joint line or the MJL. For range of motion, mild pain with flexion, extension, and rotation of the bilateral hips. For other range of motion, mild limitations in all planes of active range of motion of whatever joint that you're looking at. Specifically for the shoulder, limitations with mild forward flexion of the right shoulder, or if we're looking at swelling here, no evidence of swelling or deformity. Again, these are just some examples, not all inclusive, but just some examples. for you. Next on the list is head, eyes, ears, nose, and throat exam, or the HEENT exam. This exam entails inspection of the head, mouth, eyes, nose, ears, and throat, palpation of the head, the sinuses, thyroid, the outer auricle of the ear, and the lymph nodes, and exams using special equipment like the fundoscope, which looks at the retina, or the otoscope, which looks inside the ear canal. We don't really do fundoscopic exams at Corazon, but I just wanted to make you aware that this is part of the typical HEENT exam. Indications for this exam include headaches, sinus pain, ear pain, hearing loss, changes in vision, red eyes or eye discharge, allergies, asthma, URI or upper respiratory infection symptoms, fever, thyroid conditions, sore throat, trouble swallowing, and congestion. So just like for pain, we have many patients who present with allergies or some URI symptoms. So just completing a simple exam is very easy. You can just look in the back of their throat for evidence of any kind of postnasal drip or redness, and you can also look in their nose for any drainage. Charting examples include the nasal mucosa is pink and moist versus something abnormal like the mucosa of the nose is swollen with some erythema, which is redness. The conjunctiva, which are the whites of the eyes, are clear versus the conjunctiva is injected or red. The pharynx is normal without exudate, swelling, or erythema, which is a normal throat, versus something abnormal like the pharynx is erythematous with mild swelling, so the throat is red with some swelling involved. Next we have TTP, or tenderness to palpation over the maxillary sinuses. And then for the ear, just an example for you is the TM, or the tympanic membrane, or the eardrum, is normal in appearance versus there's mild bulging and erythema of the TM, or the tympanic membrane, versus the tympanic membrane can't be visualized due to cerumen, which is earwax. Also, just to note, Perla can also go here as well, but some people put it into the neuro and some people put it into the eyes. If you're performing the HEENT exam and it appears that they may have an upper respiratory infection, this is the perfect time to perform a respiratory exam, and then also vice versa. The exam components of the respiratory exam include inspection, palpation, percussion, and auscultation of the anterior and posterior lung fields. For our purposes, we mainly stick to auscultation. So again, please ask a provider or a trainer to demonstrate respiratory auscultation to you. The following are indications for the respiratory exam: asthma, COPD, shortness of breath, heart failure, hypertension, a history of smoking, upper respiratory symptoms, allergies, wheezing, pain with breathing, and fever. An example of a normal finding for auscultation includes CTA, or clear to auscultation of the posterior lung fields bilaterally, or BL. If you auscultate both lung fields, make sure you write in both. So if you auscultate both anterior and posterior, make sure that you specify that. The most common abnormality you will hear are abnormal lung sounds, such as wheezing, rhonchi, and rales. If you hear something out of the ordinary or something odd, please see a provider to help you confirm what you heard. Then state the type of lung sound along with which lobe that you heard it with, along with which side, again, anterior or posterior. In addition, if you can, pay attention when the sounds appear. Do they appear during inhalation or exhalation, or both? Document this as well. Auscultation is very, very easy to do. It requires little effort and takes about a minute, so I urge you to listen to as many lungs as you can. It shouldn't really be missed in any patient, and again, if you'd like this demonstrated, please ask a trainer or provider. Another exam that should never be missed on a patient is the cardiovascular exam, or the CVS exam. The cardiovascular exam includes auscultation, in which you are listening to the rate and rhythm of the heart, as well as listening for any abnormal heart sounds, such as murmurs, clicks, or gallops. I would also encourage you to listen to as many hearts as you can. Auscultation is very simple to do, like I said, and the more hearts that you listen to, the more trained your ear will be. Please see a trainer or a provider again for a demonstration of this. Also included in the cardiovascular exam are observation and palpation of the lower extremities for edema or swelling, and then also palpation of the pulses both in the upper extremity and the lower extremity. Inspection and percussion is also involved in this system, but it's rarely performed at Corazon. Indications for the cardiovascular exam include hypertension, chest pain, heart failure, heart disease, a history of a stroke, obesity, lower leg edema, diabetes, heart palpitations, leg pain, smoking history, shortness of breath, orthopnea, high cholesterol, syncope, palpitations, and anxiety. Whew, that was just a few, right? So 2 simple charting examples I included are RRR, regular rate and rhythm. So that again just goes with the rate and the rhythm of the heart. It has nothing to do with any abnormal heart sounds. So remember to always comment about if anything abnormal was heard, not just the rate or the rhythm of the heart. So that would include RRR, regular rate and rhythm, with no murmurs, clicks, gallops, or abnormal heart sounds. If the rate or the rhythm is abnormal, such as if the heart rate is below 60, that's bradycardic, or if the heart rate is 100 or above, that means it's tachycardic. So in those cases, if the pulse is high or if it's low, then it's not going to be regular rate or rhythm. The rhythm and the rate are off, or the rate is off. So you would put a tachycardic rate and then comment about if any abnormal heart sounds were heard. So you would say tachycardic rate with no murmurs or extra heart sounds. Again, these are just a couple of examples for you. If you feel like you hear an abnormal heart sound, have a provider double check it and they'll help you chart this. Last but not least, we have the skin or integumentary exam. The primary exam you'll be performing is inspection. We have Dr. Mike with us, who is a dermatology extraordinaire and will help you with anything dermatology related. Our main trainer, John, also has worked in derm for many years and can help you as well. The skin exam can be performed at every visit just by looking at the skin visible on the patient's bodies. Most skin is termed as warm and dry, opposed to diaphoretic or sweaty. Well, except for the summer months, then people may be diaphoretic. Regardless, the skin exam can be performed at every single visit and there should be no reason for it being missed, especially if you can see their skin. You can perform a detailed exam if you have some indications to do so, and indications include eczema, wounds, any kind of itching or pruritus, any kind of lesion, any kind of rash, also diabetes and allergies, as often people with diabetes have poor healing wounds or other skin conditions, and those with allergies often have some skin conditions like eczema or rashes. Again, for charting, a typical response is warm and dry. However, this may not always be the case, so please don't state warm and dry if it's not, especially if they're diaphoretic. If there is a lesion or a rash present, try to describe that lesion to the best of your ability. You can write this down in the note section or on a separate sheet of paper, and then ask a provider for help. But whatever that lesion is or that rash is, please try and describe it to your best ability and then document it in the chart. There shouldn't be a diagnosis of a skin condition with no correlated physical exam to back it up. As mentioned before, please note that some exams are missing. The psychological exam is missing, which I explained in the neuro section. Please see the blue psych sheet and blue psych evaluation form for more detail in documenting this. And please note that each new patient should receive this form to fill out. In addition, for patients who have had a newly diagnosed mental health condition and have been recently started with a medication, please have them repeat a psych sheet in 6 weeks after initiating that medication. If they're on stable medication, please repeat every 3 months. Regardless, always check to see when the last psych assessment was performed. We also don't perform a gynecological exam. We do not form any kind of pelvic exams at the clinic, and those are all referred out. So please, please, please perform all physical exams that are pertinent to the case or the chief complaint. For example, if the patient is presenting with allergies, again, please do an ENT exam, respiratory exam, skin exam. If they're presenting with hypertension, definitely do a cardiovascular exam along with respiratory exam. Same goes for diabetes, with heart failure, with COPD and asthma. If they're coming in for joint pain, again, go ahead and do a quick musculoskeletal exam and then a neuro exam if you need to. One question I receive often is, do I have to listen to heart and lungs? I always say, again, why not? As I said earlier, listen to as many heart and lungs as you can. This is going to train your ear, so when you hear something abnormal, you'll be able to recognize it. These are easy exams to perform and shouldn't be skipped. Now let's move on to the vitals. And remember that vitals are a part of the objective section. The vitals that we gather at clinic are blood pressure. This should always be measured for new patients and for patients with a current or past history of hypertension. We measure blood pressure for every single patient, so this really shouldn't be missed. If their blood pressure is elevated, such as over 150/90, wait 15 minutes and then take it again. If we're using a wrist cuff and it's elevated, also please take it again manually. We also take heart rate, respiratory rate, temperature. Sometimes we take height, but that's not performed very often, and sometimes we take weight, but that is also not performed very often either. And we also take blood glucose. Technically, this is not a vital sign, this is a point of care test, but at Corazon we document it as such. So always measure for new patients and for patients with a current or past history of diabetes. This is very, very important to be able to measure the blood glucose if they have a current or past history. Oftentimes this is missed, so please don't miss it. Also with blood glucose, please indicate if they are fasting or non-fasting. And just a pro tip here, remember to document the blood pressure and blood glucose in the graph section of the chart. So here's another pro tip for you. Not all exams need to be performed. That would take forever if you performed all of them. So if an exam is not pertinent to the case, you don't need to perform it. So for example, if a patient presents with knee pain, you don't need to do an abdominal exam or a skin exam or an ENT exam. You can skip those. But if you skip an exam, you still need to document it. And the way that you need to document this is by writing detailed exam omitted and in parentheses DEO. Do that for the first exam that you're omitting, just to spell out what's in the parentheses. Otherwise, what does DEO mean? We don't know. So first spell it out, detailed exam omitted, in parentheses DEO, and then for the next exam that you omit, often there's more than one, you can just put DEO in that area, and that tells us that you've omitted that exam. Thank you so much for your attention in this presentation. If you have any questions, feel free to email us at corazonclinicsa@gmail.com, or if you're at clinic, ask a board member, ask a provider, or a trainer. We are happy to help you. And again, thank you for your attention, and we will see you at clinic.